basically he was the physician of the century. And he came up with a lot of health patents and inventions, but also he used simple things like hydrotherapy to heal people. In his time, in around 1918, do you know what was going on in 1918, around that time? War, but also Spanish flu. And with the Spanish flu, in his clinic, he lost nobody, no one, just using simple treatments. Everyone else, they were losing people. And he used things like hydrotherapy. And different uses of hydrotherapy: colonics, jacuzzi, steam baths, water picks, ice packs, water aerobics. These are other things that you've come to know as hydrotherapy, or you may not know that as hydrotherapy, but it is hydrotherapy. So the rationale between hydrotherapy, and these can be found in Natural Remedies Encyclopedia, page 156 and 157. One, it increases circulation of the blood, it stimulates the immune system to combat diseases, and it rids the body of toxins. So detox, one of the best ways to detox is doing a hot bath, for instance. One of the best ways to close your pores is by having a cold bath, for instance. So water can be found in 3 states: liquid, solid, and gas. In all these 3 states, we can use them to heal, use this as hydrotherapy to heal. So can you name something, a hydrotherapy that uses steam, for instance?
Steam sauna.
Steam sauna. Anything else? Hot bath. Inhalation. Steam inhalation. For things like the colds and the flu and pneumonia, these things you can use steam inhalation. How about liquid? We mentioned baths, showers, drinking it, that's hydrotherapy. How about solid? Closing the pores, yeah. But ever heard of an ice massage? Yeah. No? I'll tell you more about the ice massage. Maybe it might be more appealing after I tell you about it. But basically, the physiology of hydrotherapy is this. Heat draws blood to the surface, and when you draw blood to the surface, you sweat. So you can detox. But also, heat stimulates your immune system. Your immune system, when you have a fever, is heightened. And you can create a fever through heat, the water. Cold, the primary action, it drives the blood to the interior, so it closes your pores and closes the channels between the blood vessel and the skin. Secondary action, it drives blood to the surface, so it can do just as the heat does in driving blood to the surface, if it's for a longer period of time. So the physiology, this is a normal blood vessel. When you heat it, it gets larger. When it's cold, it shrinks, basically. And if you're doing a whole body treatment, that means your entire body's blood vessel system is being expanded. If you're doing a cold body treatment, if you go plunge in a Alaskan river or something like that, I don't recommend it, but basically, you get that. Some forms of hydrotherapy treatments: hot foot baths, ice massages. Now I'll explain what an ice massage is. So I remember once we have a lady at UT Pines, we call her the Ice Queen because she loves ice massages. She loves to give them, not to have them. But people with pain, people with phantom pain, people with uncalcitrant pain, they usually get benefits from ice massages. So there's one lady who had a C-section. She had pain for years after she gave birth, and she had a C-section. And her husband took one of our seminars. He attended one of our seminars, and he actually did the ice massage on his wife. And after one treatment, no pain. Just an ice massage. And basically, it's 15 minutes just rubbing ice over the area, either shoulder, your back. Someone's saying no. But it actually works. I actually had, I used to exercise a lot. I used to lift weights a lot. And I had a torn rotator cuff. And for years, it wouldn't heal. It was stubborn, very stubborn. And after one ice massage treatment, no more pain. I mean, 10, 15 years I've had this pain. So you can benefit from an ice massage. No, you may not like it. It may not sound good now, but it's something that's worthwhile. Fomentations. Do we have any young men in the room that can fit on the table? I was going to try to demonstrate a fomentation. It's very good. It's a very good treatment to no young men. not right now. Yes. I'll put you on the list. But fomentations is something that you can do for many diseases, and we'll demonstrate that. Wet sheet packs. Kellogg was known to use wet sheet packs. Again, it's using cold, wrapping someone in a cold sheet, and using that to stimulate their own body to produce heat and stimulate the immune system as well. It helps with mental health issues, but also detoxing. You would wrap someone in a wet sheet pack, and you see yellow stains. Basically, you can pull out like cigarette smoke and things like that from the body. It's amazing. Heat compress will try to do something like that. Salt glow for all the ladies in the room. This can lead to more younger skin. You don't need Botox. You can just use a salt glow. We won't demonstrate this one, unfortunately. A salt glow. Yeah. The best thing to do is go to YouTube, type in salt glow, and you can see how it's done. It's better to see it than me explaining it. Hot half baths, neutral baths, Russian steam baths, short cold baths, contrast baths, and showers, sitz baths. One of my first experiences in in clinical medicine as a third-year resident or third-year clerkship resident. This lady came in. She had hemorrhoids, severe hemorrhoids. They were bleeding. Every week there was bleeding. She comes back to the ER, and the ER doctor says, "We can't do anything. Have you tried a sitz bath?" And I thought, what is a sitz bath? But for hemorrhoids, for prostate cancer, for a lot of lower abdominal issues, you can use sitz baths for either just hot, or cold, or just cold. Cold mitten friction, steam inhalation, irrigations as well for ear, nose. Irrigations are important for that. And like I said, on YouTube, there's many resources on YouTube. This is from Wildwood. This is our quote-unquote sister institute. And they have videos like these. They were making these videos during the pandemic. To boost your immune system, you can use a hot foot bath. We're going to demonstrate how to do a hot foot bath as well. And a dry run, not a wet run. But basically, doing these things it's very good, and things that you can do at home. Russian steam bath is more intense than a hot foot bath, but it's basically a hot foot bath that is helpful for detox, among other things, even cancers. So a hot foot bath, indications for colds, flus, headaches, chest congestion, abdominal cramps, pelvic congestions, contraindications. If you have diabetes or Berger's disease, if you have these issues, for instance, diabetes, your nerves aren't as sensitive or more sensitive or less sensitive as they are on a normal individual. So you don't want to put your feet in hot water, too hot of the water, because you may not be able to feel it. You can burn your skin or cause burns that can cause more damage than good. Berger's disease is a disease where your blood vessels are not as healthy, and you can cause your toes to be amputated because of the amount of heat or cold that they are subjected to. Snorkeling, if you have sinus congestion. I thought I had no sinus issues. And I tried this once. There was snot dripping through my nose like it was nobody's business. So it's basically a contrast, hot and cold. So 3 minutes in the hot, 30 seconds cold. This is a contrast treatment. 3 minutes hot, 30 seconds cold. And what does the hot do? Stimulate the immune system, but what does it do to raise the temperature? What does it do to the blood vessel? It dilates the blood vessels. So when you dilate all the blood vessels in your face, guess what? It drains. But then what do I do to close those blood vessels? Get the cold. Exactly. Because you don't want to be dripping all night, do you? All right. Just checking. Other things like steam inhalation. These are things that, and technically you don't want to be over the pot. You want to cover your head, but you want to, like an indirect steam coming in. Inhale and exhale, inhale and exhale. And it can also help with sinus issues as well, but also helps with the lungs. Cold shower, I know you cannot see this, but a cold contrast shower. 3 minutes hot, 30 seconds cold. 3 minutes hot, 30 seconds cold. And this helps with a lot of things. It helps to boost testosterone, balances hormones like estrogen, helps with influenza and coronavirus, helps you to lose weight. It's a lot of things that this is good for. I try to take one every morning, but that water gets too cold sometimes, especially in Maine. But it's just something that is very good. Whenever someone is sick around me, I tend to do this. Do hot and cold showers. You can do up to three to 5 rounds, actually 5 to 7 rounds. I usually do 3 to 3 rounds, and if I'm sick, 5 to 7 rounds. Praise God, I don't do 5 to 7 rounds as often. Contrast baths. And contrast baths are for impaired circulation, inflammation, strains, and sinusitis, nasal congestions. Contraindications, again, diabetes, because you're not as sensitive to the heat or the cold as you should be. And cold compress. A cold compress is something that you can use for a sore throat. I think by the end of this weekend I might need one of these. But you can use this for if you have a cold or any issues that may cause a sore throat. Heating compress, sore throat, laryngitis, chest cold, whooping cough, bronchitis, headaches even. If you have migraines, you can do this to help with your migraines. Contraindications, a chilled person, someone's coming outside from a cold environment. You don't want to do this on someone who's cold already. Fomentations, this is what we're going to try to do in this young man who's coming up next. But basically, I've used fomentations recently to help someone with COPD, and initially he had no color in his face. And also he was coughing up a storm every time we saw him, every meeting, coughing up a storm. And he couldn't clear his sputum. And the thing with COPD is your lungs are like floppy, and it's not muscular enough to clear out the junk, basically, the phlegm or things that may get stuck in the lungs. And we've used the fomentations on him for about 3 to 4 weeks, and lo and behold, his colors start coming back. He's starting able to clear his lungs, and he's praising God every step of the way. But it's also good for other things. Pneumonia, it's good for cancers in the lungs, for instance. It's good for a lot of things that can affect the chest. Chest congestion, asthma, pneumonia, insomnia even. It can help with insomnia. Pain, sprains, contusions, contraindications, abscesses if you have any skin lesions on the chest, heart disease. Obviously, you don't want to do that. All right, we can stop here. We could probably demonstrate a hot foot bath and a fomentation. Who wants to demonstrate? Well, let's start with the fomentations. Young man. Yes.
Can you explain, I guess, the process, what happens, based on that picture, it was like a hot bath and cold compress at the same time?
Yes.
Like, why is that at the same time?
So you're basically, I'm drawing. All right, I'll ask you. What happens when I add hot water to the feet?
Improves blood circulation?
Exactly, to the feet.
Correct.
So I'm drawing more circulation to the feet.
Okay.
So I'm making it less congested in other areas. So I'm drawing that blood away from that area to the feet. But I'm also giving that area heat as well to take care of that, the lungs or any tissues that are in need of healing.
So the fermentation is hot, the compress on the head is cold, yes?
Yes, exactly. Technically, you don't have to do the cold compress. And the cold compress also protects the brain because the heat, so it doesn't get to the brain. But technically, you don't have to do the cold compress in this
Is
area.
this for the person no matter the fever or no?
Oh yes, you can. It also helps with fever, among other things. Also helps you to sleep. The hot foot bath, like we'll demonstrate, also helps with sleep. All right, young man. Does someone like to hold? I think you're safe. Just in case. Someone like to hold a. You may have to sit up a little bit. All right, so we're going to pretend that this is cold and this is hot. All right. technically you want to have it folded like this, and then fold it halfway. Yes. Quarter. There you go. And what you want to do before he lays down, you see that thing underneath? You have a fomentation under his back. What you want to do is, you can also do it chest down as well. On this person, because the person who I was telling you about, he couldn't lay down on his back, so we had him lay down on his chest instead. So what you want to do, and you can just add the hot water to the bucket or wherever you're going to have it. And you can actually put the towels in, you can wet the towels and put them into the microwave as well. Don't worry, they'll be safe. You can put them in the oven as well for some time. But basically what you want to do is make them hot, as hot as possible. And you can have hot water in here. And what I do is, even with my bare hands, or if you want, have gloves on, you can put the towels in the water. And while you have it in the water, you can rinse them or squeeze them out with the water. You want to keep it at least a little wet. You don't want to make it too dry. And then you place that towel inside of this. So this is hot. This is very hot. Place it inside and have him lay down on this. So, this is the acting is not part of this. Yes. So the same thing. It's a huge towel. Yeah, this is a huge towel. Oh, that's good. So same thing. You want to fold it like so. That you have two options. So the first option, if it's too hot for this person, for instance, you don't want to put it closer to his chest if it's too hot. So you ask him, is this too hot? And if it's too hot, then you put it at the second layer. That way, so this is going to be hot, right? I put it in the bucket, and while I have it in the water, I twist it to wring it out, to get the water out. I get most of the water out. And then I can place it here. So this is very hot. This is larger. And then I can put it on his chest. He's alive. He's alive. But I'll ask him, is that too hot? Yes, it's too hot. If it's too hot, I'll take it off. No, it's going to be too thick on the outside. I put it here. And that's it. So that way, yes, he's good. What you want to do also, you can technically do this without a hot foot bath, but when you do it with a hot foot bath, it's called a general revulsive, and the hot foot bath helps with, like I said, pulling the inflammation down from the chest, or pulling the inflammation down from wherever we need the treatments to act upon. I don't have a bowl or a. Yeah, those are. You want something where it can be above his ankle. A bucket where it could be above his ankle, and I don't have something that could be helpful. Right. Yes, but. Let's ask the young man. But also what you want to do is to keep the heat. You want to cover him. blanket. This is a wool blanket. You can get it from like the Army, Navy store or whatever.
Can we leave him out there for the rest of the segment?
Yes, we can. You can cover him. If you're going to use a cold compress, obviously you would start the cold compress first before he lays down, but you don't necessarily have to use one. These things work without the cold compresses or the hot foot bath. If the person needs to sleep, for instance, you can also add the cold. Yes, he's already sleeping. You can add the hot foot bath as well.
And how long do they stay?
Good question. So you're going to do this for at least 25 to 30 minutes. And for every 5 minutes, you're going to change the hand towel from this. So you take this off, and obviously he's going to be naked. Well, at least his shirt's going to be off. So what you want to do is, once you take this off, you would dry the area, and then you would make this hot again. So you want to keep that water hot. You can't use the same water. Just make it hotter, even. So you would use this, just like we did before. Just like we did before, and while you're making it hot, you can just squeeze that water out. Not all the way, just as much as you can. Yes?
Can you, not use a towel, but use like a heating pad or something like this instead of, or is it have to be wet for it to like?
The heating pad does not penetrate as much. So that's why nowadays they have something called infrared pads or whatever. But infrared pads are very expensive. But you can use the same thing and get the same effect just by water.
Could you use something where you put it in the microwave?
You can. You can use it, but you're going to need, I think, 3 to 5 minutes at least in the microwave, depending on the power of the microwave, obviously. But you're going to also need gloves to hold that. Either way, if you're doing this, I'm bold enough to not use gloves when I'm doing this. But the thing what I like about this is the ends remain dry. And in the middle, you want to get the middle at least closer to the ends, all the way wet with the hot water. So where your hands are, they're going to be dry. And in the middle and closer to the ends, that's where you're going to have the effect of the heat going into the chest.
You gotta squeeze it.
Oh yeah, you got to squeeze it as much as you can. Get not all the water, but most of the water out. Does that make sense?
Yeah.
Yeah. So 3 to 5 times you're going to do this. You can do up to 7 times depending on the person's and how much you can stay there. How long can you stay there? Yeah? All day? At least 30 minutes. So say if you have 5 treatments, 5 times 5 is 25, so that's about 30 minutes. You're going back and forth and drying him and things like that. It's going to take about 30 minutes. But you can go to like 40 minutes if you do 7 times. Normally I tend to do at least 5 times.
Do you
And then how
like
often?
once a day? Or?
Yeah.
Yeah, this treatment will wear him out. So once a day. Once a day. You don't want to do it too often. These things are very powerful. It looks very simple, but it's very powerful as well. And it can, even cause death in certain instances. But this is, don't be afraid. Not today, not today. But what I'm saying is doing it correctly is making it properly, doing it properly is key.
Is there a difference between adults and kids?
Yes, good question. So obviously the heat for children is, the heat tolerance for children is going to be different. So, but I mean, you may want to do it 3 to 5 times instead of 5 to 7 times in children. And you may want to shorten the amount of time that you have between the changes of towels.
So would the person report like that they feel better after this? Or what are we
Oh, yeah.
looking for?
Yeah, so one thing, in my guy, for instance, every time I do this with him, he starts coughing afterwards and he's able to clear. So that's one good sign. But also, they're going to feel less congestion in the chest if they have things like colds or flus or pneumonia. They feel less congested. Also, fevers may go down, different things like that. So those are things that you can gauge during that. You have a question? That is a good question. I was going to say that for my guy, we use eucalyptus oil. So the menthols and the eucalyptus and the peppermint, you can use it for chest congestion. Ever heard of Vicks?
Yes.
Yeah, Vicks is a rub that has menthol, camphor. Camphor as well is camphor essential oil is a good oil you can use. Eucalyptus oil, peppermint oil, very good for the chest, very good for asthma. So if you have asthma, you can also use steam inhalations with peppermint oil or eucalyptus oil or camphor oil for the chest.
Is the eucalyptus oil as effective in the cold compresses?
No, I wouldn't use any essential oil in the cold compress. The thing is, heat distributes those essential oils, but a cold is not going to do that.
And you can't use a warm compress on the nose when you're doing this?
You can if you want.
You can?
Yeah, yeah.
I was just wondering, because I know you said you're trying not to have the heat come up to.
Yes, when you're doing especially with a hot foot bath,
Okay.
you're doing it so that the body, especially you're covering the body as well, so that the brain doesn't get warm or too warm. So you can use the cold compress, or what you can do is, instead of doing a cold compress, you can use, are you okay? You always ask if you're okay. You can use cold water throughout the treatment and just keep him cool, wipe his face, wipe his neck, just throughout the treatment as well. So after five rounds, so this is the last round, right? This will be the last round. Are we all clear? Is anyone confused about what to do, when to do it, how to do it at this point? All right. So this will be the last round, and I'll wait how long? 5 minutes, sorry. 5 minutes. And what I also like to do is, especially if the person has COPD, you can do a little massage. So something like this. Yes, he likes that. And the good thing is you get the treatment as well. When you have like eucalyptus and peppermint, you feel that on your hands. That's very soothing. So you can do this, talk to the person, I forget though, one thing you always do before you start treatments is what? Pray. Always pray, because honestly, there's no healing in the fomentation, there's no healing in the water, there's healing only in God. So always, talk to the person about different things and spiritual things. My gentleman, he wasn't even spiritual at all, even Christian, and he started asking me about baptism. Simple things like this. It is said that these things, or the health message, is the opening wedge. Yes. And we do these things to people who don't know God. They start opening up and wanting to know more about God. Amen. So you can do things like this. You can do it for 2 minutes or 5 minutes, depending on how energetic you are. This is the last treatment or last fomentation. What you do is you take it off, and obviously, again, his chest is, his shirt is off. And what you do is, this is the fun part. Yes.
Oh, wow.
But it's a cold friction. It's not like throwing water on him. So you bring it out.
Do that if you wanted to.
If you want to torture the person, yes. But you have the cold water, and what you do is just wipe the chest. Yes, he's cold. What am I doing with the cold? Closing the pores, because you don't want him to. One thing with closing the pores as well, you can lose electrolytes. When you're sweating, you lose electrolytes like magnesium or sodium or potassium or other things from your bloodstream. So what you want to do is close your pores so he's not fatigued later. Once I did a treatment or having cramps. For instance, when you sweat a lot, you can have cramps. And once I did this treatment, and I said, I don't need to close my pores, I don't need this cold water. And for the entire week, my legs were just weak. It's almost like I had arthritis and fatigue, and all these issues were happening. And I was thinking, why am I cramping? Because of and it was because of the treatment, and I didn't close my pores. For an entire week, I was basically sick. So these things can be very powerful if they're not done correctly. So always close the pores after heat. You have a question?
Yeah, afterwards, should the person take a shower after the treatment?
They can, because they're going to sweat a lot. But say, for instance, they're sleeping, I would just leave them sleeping. And then he's going to wake up, sir. Yes. And same thing, close the pores. And same thing with the feet. Now, with the feet, if he's doing a hot foot bath, what I would do is take his feet out and pour cold water on his feet. Yes. You do?
Doing it.
Oh, now you're a little isolated. So, was that clear? So who can do this? Who can demonstrate this? Yes.
Because this is so laborious, there are other things that you could do that will give you the same results. Like if you do a sauna, what is it, where you have that sheet, if you're going cheap, you have that shower, the shower, and you wrap it
Curtains.
around them in the heat.
The curtains, the shower curtains?
Yeah, the shower
Yeah.
curtains. So this would have the same results?
No, especially this treatment. You don't want to make him too hot in this treatment. Now, the hot foot bath, you can use the shower curtains and things like that, but you don't want to make him too hot, especially when you're doing the reverse, the one with the hot foot bath, general revulsive. You don't want to use too much heat because, like I said, you can cause the brain to overheat.
Well, usually you do put cold.
You can,
back too.
yeah. But you're using more heat on average during this treatment than you will, because you have his back and his chest. You're using more heat on average. You have more areas covered with heat than you do with any other treatments. It's similar to the fever bath. You don't want to do anything to make him even hotter, basically.
Do you put socks on afterwards?
You do. Put socks on afterwards, or keep him covered. Say the person wants to just lay down and sleep, even after the cold and friction. Just keep the wool blanket on and have the person sleep. So technically, you do want to have them sleep or rest after 20 minutes because it does. When you're sweating, it's almost like you're in a marathon. It's like you're running. So having this person rest afterwards, even like this, could be good.
I have a question.
Yes.
Do they, you said something about losing electrolytes. Do they need to drink anything after?
That's a good question. You can give them water afterwards. You can give them fruit juices before, so they're not losing too much electrolytes, or you replenish electrolytes before they go into the treatment. Yeah. Or even herbs. You can have them. There's certain herbs that will help you to sweat more, like ginger. So you can have them do ginger tea, and that will help them to sweat more. So that's a good question. You can use different things to make the person sweat more, or cool down more, or things like that.
Like electrolyte drinks, like Under Armour or something like that, have potassium electrolytes. Is that okay?
I would try not to use those. I would just use like natural fruit juices, which have you can make your own fruit juices. But say, like my sister was saying, it's laborious and you don't have time, or you just this is something that you need to do. You can use those things as well, like Pedialyte. There's an adult Pedialyte. You can use that as well. But especially when someone has colds and flus and all these things, the less sugar the best. And those things have a lot of sugar in it.
For the fruit bag, can we, or do we have to put less salt in the hot water?
You don't have to, but you can use Epsom salt. Epsom salt has a drawing agent or drawing purpose to it, so you can use that Epsom salt. You can use Himalayan salt if you want. You can use Celtic salt if you want. I wouldn't recommend it because it's too expensive. But you can use a lot of things, like even charcoal. Charcoal in the water as well to draw out certain things. Yeah. Now, does that make sense? Does anyone want to try it? It is too much, but it can be too much. But at the end of the day, it works, and you're actually building a bond with someone. I think there's a quote that says, "The Savior mingled with people in order to get them to adopt the message that He came to give." And this is mingling with someone, whether it's someone in the church or outside of the church. This is an up close and personal experience that someone can get to know you and you can get to know them, and you can address their issues and concerns, and then show them who Christ is. Yeah. This is Christ's method, essentially. Any thoughts? Any questions? Any other questions? Are we clear?
Have you ever taken a sauna?
I have.
They're fun, aren't
They can be.
I'm from Montana, so I took one 110 degrees
Yeah.
and then chopped a hole in the ice in the river. and jumped in there.
You're one of those, huh? No, you know, I don't sit still. I'm always on the move, so saunas is not my thing, but maybe one day I'll get there. But I like, the contrast showers and things like that. I'll do that because I can do that while I'm taking a shower. I can do hot and then cold and hot and cold. And everyone at least I hope everyone here takes showers, so you can take a hot and cold shower every morning, practically. And it's both preventative and curative as well. So, for instance, if I get off a plane and someone's coughing and sneezing, you know what? The first thing I do, I go take a hot and cold shower. I remember once I was at a health expo, and you lay your water down and you're doing your work, and I came back and I saw two water bottles there, and I thought, which one is my water bottle? And I chose one, and I said, I'm thirsty, and I drank it, and guess what? I got sick. I felt myself getting sick. I didn't get sick at the time. I felt myself getting sick, and I said, you know what? I'm going to take a hot and cold shower tonight. I did 5 to 7 rounds. And the next day I was getting sicker, and I said, you know what? I'm going to do another one. I did another one, and in 2 days, nothing. I was knocked out in 2 days. And obviously I was doing other things like Echinacea Golden Seal, which we'll talk about. Echinacea Golden Seal is something that I do before I get on a plane. And even after I get off the plane, I do Echinacea Golden Seal as well.
Yeah, I was just gonna add that, with doing the hot and cold, also, like, if you know the different herbs, you could do oregano. Where you put
Oregano
that,
oil,
after
yep.
you take the shower, you put that.
I'm not a big oregano person.
Really?
That thing burns.
Well,
Although,
you do the carrier oil with it.
yes. Oh, I mean taking it, like
Yeah,
internally. You can take it internally, but
But you usually brush it down with water, right? You don't?
I mean, I'd rather peppermint. Yeah, I'd rather
But you can
peppermint.
put oregano on your feet.
You can.
And put the socks on.
You can.
Yeah.
Yeah, I try not to do oregano because oregano can actually burn the skin.
It can.
Yeah, I've seen someone who was actually, she said she was, which I don't recommend this. I don't know what she was doing, but she was actually dripping the oregano oil into her mouth, and she burned her skin. Oregano oil is very potent and strong. That thing can kill bacteria, molds, whatever. Those are a very potent essential oil.
But it'll knock it out.
Oh yeah, it'll knock it out, but it won't knock me out either. You had a question.
Yeah, we want to know how long can safely take oregano, golden seal, and echinacea safely?
A good point. So golden seal, I explained to someone, it can cause dizziness, like vertigo, if you take it too long. Some people maybe 6 months, some people maybe a year. But I remember a friend of mine was taking oregano for a year just for preventative sake for COVID. And she started getting dizzy. And they did MRIs, CAT scan, they did all these tests, and they couldn't find anything. And then her daughter researched the golden seal and found out that it caused dizziness. So these herbs, I think God recommended or gave us these herbs to take when we're sick, not when we're whole. So if you are healed or if you are not sick, I wouldn't recommend taking these powerful. Some of these herbs are very powerful, so I wouldn't recommend taking golden seal on a daily basis, or even echinacea, especially oregano. I wouldn't recommend. You can take oregano, the herb itself, with your food or your meals or whatever, but I wouldn't take it on a daily basis. And same thing with all the strong, powerful herbs. I wouldn't take on a daily basis. Ginger, you can take on a daily basis. Fenugreek, all these things that or are common, you can take them on a daily basis. And they can actually help to prevent you from having these issues, flus or colds or whatever. Now, you may need the stronger ones like echinacea or golden seal or elderberry when you do get the colds and the flus and these other things. That makes sense? All right, so first, how many towels do I need? How many bath towels do I need for this? Two, at least two. How many hand towels do I need?
2 or 3.
Two. How many forms of water do I need for this? Hot and cold, yeah. And how many sessions of the fomentations would I need to make this an effective treatment? 5 to 7, yeah. And after I finish the treatment, what do I do? Yeah, that's the most important things. This is a very simple treatment you can do at home. If someone is coming down with a fever or they're congested, you can use these treatments. Any other thoughts, any questions, any concerns, besides just being laborious? How did you feel, sir?
Feel better.
All right. Yes, we can do the hot foot bath now.
Okay.
What other young man wants to do the hot foot bath? We can if you want. Yes.
You want to do that? Okay. Well, while we're getting ready to do the hot foot bath, I want to introduce the CEO of Bond Community Health Center. And Bond has been partnering with the church here in a lot of the community centers here trying to sponsor the program. So they're big sponsors here. Dr. Temple Robinson. Doc, you wanted to say something to? That would be great. And that is my boss, by the way.
Thank you all. This is an absolutely wonderful event and a wonderful weekend that you've sponsored here. I'm glad that we're able to partner with you. We always talk the way I was raised. You worship God through service to man. That is how I was raised. I had a dental appointment on Friday, and the dentist said, "What are you going to be doing this weekend?" And I said, "Well, there are all kinds of Christians in Tallahassee." And I said, "I got to make sure I have on the right clothes." He said, "What are you talking about?" I said, "Well, I got some Sunday Christians that I got to go to a health fair on Saturday, and I got some Saturday Christians I got to go to a health fair on Sunday, and I don't want to show up at church with the health fair clothes on and show up at the health fair with the church clothes on." And he said, "Y'all are so blessed that people want you to participate." So I am so proud to meet you. I'm looking forward to having conversation. I want you all to embrace the holistic Christian component of what is being shared. All medicine originated from nature. Some of it then was put in a form, a synthetic form, if you will. If you go back as far as aspirin, and you look at God's willow tree and the bark of the willow tree, okay? That is aspirin in its purest form, okay? So what we're doing here is not contrary to what we do in medicine, because it's all medicine, it's all coming from the same place. I believe in moderation in all things. I was raised in the South by very wise people. You all know the old saying. You look at this, and it has a fancy name. It's called fomentation to the chest and fomentation to the back. But it's that old saying, feed a fever, starve a cold. Yes? But God also gave you brain. We're going to do this. And then if you don't get better, after doing this a while, then you go to plan B, and you go somewhere and get some lab tests done and get checked out. Because if your electrolytes are off, you don't know how far they are off. All right? So I want you to embrace this, learn it, use it, be careful. Doc's not going to tell you to do anything that's going to hurt you. All right?
Yeah.
Hot foot bath. He didn't say scald the skin off your feet. All right? Yes, you can put oregano in your spaghetti, but oregano oil, like he said, will burn. It's very strong. Turmeric is good on a lot of things, but turmeric on a wound will make a mess. Fever leaves are great for a lot. I was raised in the South for a lot of things. Fever leaves on a wound or on a sore joint, you may end up with salmonella poisoning. All right? So all things in moderation. Use your good brain that God gave you. Listen to the hair on the back of your neck. He put it there for a reason. Okay? This is a good man. But if you go someplace and what is being taught doesn't sound right, doesn't look right, make the hair on the back of your neck stand up, then get up and leave. I am so happy to be here. Thank you for my team. Miss Bean is here. Miss Taylor is here. Taylor Humphreys, she is our community health worker and health educator. And I don't think there's anything that we're going to teach you or share with you that is going to be contrary to the church. Okay? We can't do what we do, but through God's strength. Okay? And I'm not just blowing smoke. You've known me a long time, and you know I'm a prayerful woman. And you know that there's not a thing that I do or a decision. I have to make some hard decisions, and a whole lot of prayer goes in it. I just got to be wise enough sometimes to hear that response. Okay, we ask God for a lot of things sometimes, and He's trying to tell us, and we still want to do what we want to do. So that's the biggest challenge, not to get your head so big that you can't put your shirt on, you know? But thank you, team. So we're going to be here. From here, it looks like we've got some prenatal vitamins there on the table. Right. Nothing kooky. We're not trying to drug anybody. We're trying to make sure that women who may wake up pregnant, you know, are prepared for this. And that if you haven't been eating well, that you know, you want to be healthy before the child comes, not start taking pills and eating right after you realize you've been blessed. You want to be prepared for this. So I see that. We'll look at blood pressure, because a lot of the medicines that we talk about, a lot of the herbs, some increase blood pressure, some lower blood pressure, some, you'll be surprised, lower blood pressure a lot. So I will remind you, and I'm going to hush, when you go to your doctor's office, when you go to your dentist's office, when you go to your practitioner, whoever you're seeing, you make sure you talk about everything you're taking, not just what you got from Walgreens, but what you're taking out of the yard, what are you taking out of the cabinet, what you concocting yourself, all right? What somebody else gave you. And last but not least, don't eat everything somebody brings you, all right? And I'm serious. These people will bring you stuff, try this, try this. You wouldn't eat a plate of food if they brought it to you, but my patients will eat something in a Ziploc bag that somebody gave them, and they don't know if it's sawdust or heroin. They don't know what it is, okay? So don't just eat anything anybody give you, okay? Study it, know the person, and if you wouldn't go to their house and eat a plate of food from them, don't take something somebody give you, because you don't know what you're going to get, all right? Now, we see some real spooky stuff. Thank you, Mr. Otunye, for inviting us. Thank you, Mrs. Otunye, for putting up with me, working him to death. That's a great couple right there. Y'all have good health and temperance leaders here. Thank you so much. I'm looking forward to having more time with you.
Yeah, thank you. Dr. Robinson, yes. It's all about common sense, honestly. It's, even turmeric, she mentioned turmeric. Turmeric you've got to know the power of these herbs. Turmeric can lower your iron. Turmeric is a chelator of iron. So you can't take turmeric every day because you might be iron deficient. So know what you're taking and how you're taking it is important as well. Like oregano, like I said, you cannot just put oregano oil, put it in water. If you're gonna take it, put it in some hot water and take it, like 4 ounces of water, a couple of drops of oregano oil in hot water, rather than holding it over your tongue, trying to burn your skin. So common sense is also important. All right, are you ready?
Yes, sir.
All right. So we're gonna do a hot foot bath, and pretend that this was filled with water enough to cover his ankles. Yes, sir. And technically, he'll have your foot off, your shoes off. No, you don't have to take it off. It's no? Okay. He wants a very good experience with this one. Yes, you're making it authentic. And the Oscar goes to... so the water should be 102 degrees to 104 degrees. However, if someone is diabetic, you want to keep it at 102 or a little even under that, because of the effect that it can have on this person's skin, being that he cannot sense or feel the heat of the hot water. So you can cause actually blisters or other issues from the water, being that this person is diabetic. So that's the only contraindication. Also, if you have Berger's disease, if you have blood vessel issues, you may have contraindications of that. Berger's disease is something that is very rare, but you do want to ask people what they have that may be contraindicative to this treatment. All right, so first things first, I have this towel here that's going to go over his neck. I'm going to, Brother Gabriel, you want to hold this? So how hot is this water? 102 to 104. It's going to cover his ankles. You can add things in it like Epsom salt or charcoal or essential oils. Or you can add things to it like garlic or onions. No. No apple cider vinegar. But onions and garlic, and we'll talk about onion poultice and how it's very good for colds and flus and other things like that as well. But in this case, what you want to do is wrap the person. You can have more than one towel or more than one sheet, I should say, blanket. And what you want to do is wrap the person. One second. Yeah, no, yes, you want. I want it down a little bit. Yeah. Yes. All right. So you wrap him up. Then you want to make sure before you completely wrap him up, make sure that this is covering his neck. Basically, this helps to keep the heat inside. You can use a pin or something to keep this, like a clothespin or something like that, to keep that tight.
The towel, the hand towel is dry.
It's dry. The hand towel is dry, yes. Now you can use something else to cover him as well, and also cover the hot foot basin, duffel bath basin. And then, like what Sister was saying, you can also use a plastic cover, like a shower curtain as well. So what you want to do is basically cover the basin, and that creates like heat to stay into the hot foot bath treatment, or stay into the tent. It's like a tent-like fixture. This is it. Basically, it's very simple. What are some benefits of the hot foot bath? It's an immune booster, helps with hot blood pressure, helps you to sleep. If you have struggle from insomnia, you can use this. If you have congestion, either lower or upper congestion, you can also use that. Headaches and migraines, you can also use this. You technically don't have to have a tent, but basically it's more beneficial, more effective if you do have a tent. So you see there's no tent there, right? This can be more beneficial if you're using a tent as well. And it's that simple. And all you add to the water, like I said, things like charcoal or ginger, essential oil, or garlic, onions, different things. You can add that to the water as well. All right, so how hot is the water? 102 to 104. And again, if you're diabetic, keep it at 102 or keep it at less than 102. But for someone I know someone who likes his hot foot baths or fever baths, we usually keep it at 102 to 104. But he loves his hot fever baths at 108. So no, he doesn't like that.
What thermometer are you using?
You can use one of those. I don't know if you get from Walmart or something like that, just to measure the temperature of the water.
Like what you use for a baby?
But yeah, you can. You can also use your elbow to measure the temperature. Say you don't have anything available, use your elbow. Stick your elbow in there. If it's burning your elbow, then it's going to burn his feet. So that's a good way, a good measure. If you don't have anything on you, but you want to use that as a treatment, you want to use your You have one, yeah. Or just ask the person, is this too hot? You can cool it down with ice. You can cool it down with cool water before you have the person start the treatment. Now, for this treatment, at least 20 minutes, 20 to 25 minutes. And while you're doing the treatment, you can talk to the person, but also keep them cool as well. They're going to sweat. Cold water. They're going to sweat and just douse your face. What I like to do is also, the eyes can get cold. So what I do is I just press the eyes with cool water. And that brings some relief. Any other questions, any thoughts? It's very just that simple.
Said no to the episode of vinegar. Why?
So what if I were to put vinegar on your skin and leave it there for a long time? Huh? It probably burns. It probably will definitely burn. Yeah, it's the water, but still, you know, our skin are very sensitive. One of the most sensitive organs that we have. And I don't like to put things like that on my skin, and even on my feet, which actually can draw certain things into it. I don't like to do that. That's another reason why I don't like putting certain things. Actually, I will talk about an onion poultice and what that can do, and I'll explain why I don't like these things. Yeah. So, any other thoughts? Any questions? It's very simple. So what I did was let's reverse. I had this wrapped around the chair. And from the chair, so you can have this wrapped at this point. From the chair, you can have one side just wrapped around him. There's no basic techniques to this, but just make sure he's covered enough. And then you can wrap him again with another sheet. Does that make sense? All right. You think you could do this at home?
Yeah.
You can actually do this at home by yourself. You don't even have to do. You don't need another person to do it. So if you ever have a headache or anything that is any congestion, you can also use this to help. Any thoughts? Any questions? All right. Thank you, sir. Thank you, young man. But also, wait, hold on, Judge, get your cold. Yes. So, again, always close the pores. Otherwise, this person can be arthritic by the end of the day. So you want to take his feet out. You can hold this under his feet and pour cold water over his feet. And then you dry his feet. I won't dirty your towel. Whose towel is it? Yeah. That is good. And then you put his socks on at the same time. And then he can go to bed. He can take a cool shower afterwards. So forth and so on. Any thoughts? Any questions? Yes.
Any of you get massage therapy? You know, kind of massage, gonna open up your pores, just like Dr. said, and you need to close them to make sure you're well covered, because you'll get a chill, you'll get cold. But it sounds counterintuitive, you put something cool on after a massage, but the pores are opened because the massage therapist has worked the muscles and has brought the blood to the surface. And you will find, I'm freezing. Well, that's because, as Doc says, you didn't close the pores, and so your pores are still open. And
your massage will go by the wayside because, like he said, you'll feel arthritic in the morning. You're like, good grief, why did I go do this and pay all this money? Well, that's the reason.
Thank you. And that's why a lot of people get sick as well. After massages, people can get sick after massages. Because massage is like an active detox. And if you don't shower or close pores, you can actually get sick because of it. Yes, he's strong. He's alive. He's alive. So thank you for that. And the cold compress basically is very simple. What you do is no. What you can do is you can give the young man that. By the way, the young man can take that. Yes. So with the cold compress, you can use like even a sock. You can put a sock, like a cotton sock or anything, or like a wool sock, dip it in water, put it in the freezer. About 10 minutes later, wrap it around your neck, and wrap a scarf around your neck. Set, simple. So if you have what is a cold compress good for? Exactly. So no, it doesn't close the pores. It's for sore throat or for anything, any infection or inflammation, congestion as well. Sinus problems, also insomnia as well. Yes, it's going to be cold. Let me show you. Is someone blocking it? Oh, there you go. No? Oh, there you go. So sore throat, laryngitis, chest colds, whooping cough, bronchitis. Yeah, heating compress. Yeah, the same thing. Cold compress, heating compress. Because it's cold, but your body heats it up. Your body is trying to get warm. So the cold forces your body to heat that area up. And the cold brings the heat from your body. And if I bring the heat, it opens up the blood vessels. And so you can heal from these issues. Does that make sense? So you can put a sock, you can put a rag, whatever it is that could fit around your neck. Make it cool or cold. Put it in the freezer, and wrap it around your neck. Wrap a wool scarf or something around your neck afterwards, and you can go to bed with it as well. You can make it, put essential oils or Vicks or different things like that as well. Oh, giveaway.
Yeah, baby. Let's do a little raffle draw before we get started so we can give it away. We've got a lot of items to give. We want to make sure everybody gets something.
My volunteer.
Oh, volunteers. They got something too.
I found this to be a good book. It tells you what you can use for different things like diarrhea and diabetes, different foods you can use. So if you find this book, it's like $25, but you can get it. Huh? Oh, so see, Sister Ruth, this is a very good book to have. What's good for the heart, what's good for bronchitis, what's good for arthritis, and why is it good for arthritis, why is it good for all these other things. Yes, young man.
Okay, so we have some more goodies to give away. My assistants, Emily and Olivia, are going to call out a couple of numbers, so get your tickets ready.
345071.
Yay! All right, so that's a infrared digital thermometer from Bond Clinic.
Three, 4, 5, 1, 0, 8.
Oh, yay! All right. Two more.
Three, 4, 5, 0, 7, 5.
Yay! All right, one more.
3, 4, 5, 0, 7, 7.
We'll have some more right after the giveaway again.
All right, so next we're going to talk about things you can use from the kitchen. Oh, yes. Where's the door? Where did I put that? Someone have a clicker? Someone seen a clicker? I don't have it. I did. No, it's not. All right, we can probably just. Hooray for Gabriel. All right. So herbs, natural things from your kitchen cabinet can be used, or from your garden can be used as for treatment. What is an herb? John Lust, who wrote this book, The Herb Book, page 3 says it defines an herb as the term herb is often applied more generally to any part of the plant, root, stem, bark, leaves, seeds, blossoms, etc., which has been used for such purposes as medicinal or medical treatments, nutritional value, food seasoning or coloring, or dyeing other substances. So an herb basically can be something like ginger, or it can be something like dandelion roots that we don't really eat on a daily basis, but we can use it for medicinal purposes. Other things like cabbage, potato, charcoal, clay, comfrey, onion, and figs can be used as herbs or for medicinal purposes. And the Lord has showed us that we can use these things for antidotes for diseases. I'll read one of these for time's sake. Manuscript 65, April 25, 1899, it says, "The Lord has provided antidotes for disease in simple plants, and these can be used by faith with no denial of faith. For by using the blessings provided by God for our benefits, we are cooperating with Him. We can use water and sunshine and the herbs which He has caused to grow for healing maladies brought on by indiscretion or by accident." So yes, we are to follow the laws of health. And the sunshine and the water, we can use these things, but we can also use the herbs. And some people say, you know what, I'm not going to use medication, but I'm not going to use anything else. And we can actually use the herbs in faith, knowing that God can use these things to heal. And different things you can use, like charcoal, activated charcoal. I have this here, activated charcoal. You can purchase this at health food stores. And it's not the charcoal bricks that you find at Walmart. Do not use those. But activated charcoal is actually an activated herb from either different plants, the different trees, I should say. The one of the most potent ones is from the eucalyptus tree. Cabbage, aloe, potatoes, these things you can use for different things. Clay as well. What do you think you can use clay for? Detox, so people use it for clay masks. Green clay is known as something you can use for detox, but also drinking internally. You can acid reflux, a lot of things. So we know that clay can be used for these things. We should use them. But we use different things that are provided through us for in clinical medicine instead of using these things. But clay has a lot of minerals in it, for instance, that can replenish your body with the minerals that you need, even for osteoporosis, osteopenia, a lot of these issues. Cabbage, what can you do use cabbage for?
Swelling,
Swelling, joints. You can actually make cabbage poultices. Just grab one leaf and crush the leaf, put it on that joint and wrap the joint. What I use for wrapping, something like this. You can buy these at Walmart or other places. You can wrap joints with these things. And just wrap around the knee or the joint, whatever joint, elbow joint, ankle joint, sprained ankles. Say you sprain your ankle. You can crush the leaves of the cabbage leaf, put it on your joint, and just wrap it. And the pain and inflammation will go away. Also cancers. I've breast cancers. We usually put cabbage leaves on the breast tissue, and it helps with diminishing the tumor. Fibroadenomas in the breast as well. It helps to shrink those as well. So any types of inflammation, wherever it is, you can actually use cabbage for that. Onions, what can you use onions for? Colds, detox. It's also one of the best things to use for asthma. Whenever you're having an asthma attack, cut open an onion and smell it. There's a lady in Kenya. Lady in Kenya, she is the grandmother of someone at UG Pines. And she said she was in the garden one day and she couldn't get to her inhaler. She had an asthma attack and she knew that or onions worked for asthma. So she bit open an onion and all of a sudden her asthma attack went away. So, but not only curative, but preventative. You can use onions as a preventive means for asthma attacks. You can also use it for coughs and flus. There was and fevers as well. There's a lady who would not go to the hospital. For some reason, she had, she did not trust the hospitals. And she said, what can I do? She had 104 degrees fever. And she said, I'm thinking in my head, you need to go to the hospital. And she said, I'm not going to go. And it was causing also mental confusion as well. And I said, okay, since you don't want to go, let's do a cold bath on your feet. No cold. I said, what else can we do? So all I did was slap on some onions. I cut the onions in pieces and put it on her feet. And within 5 minutes, her temperature was down. It's like 101 or something to that effect. But it's these things are very good. But also, to your point, after 5 minutes of having onions, I was smelling it on her feet. I was smelling it in her breath. So she was breathing out the onion. So imagine if I put something that's very caustic on my feet. It's actually going into my pores. Your feet are very sensitive. The bottoms of your feet are very sensitive. So you can take in certain things from your feet. So, but things like charcoal, it actually draws things from the body. So you can draw toxins from your body from your feet. So that's why you can put things like charcoal into the activated charcoal, that is, not charcoal bricks, activated charcoal in the water. But things like vinegar or these things, I don't like putting in those areas. Does that make sense?
Yeah.
Yeah.
So what's the difference between the red onions, yellow onions, green onions, and why would the red onions, the onions would create gas in your stomach?
Oh, eating it, or you mean?
Yeah.
Okay. For in my experience, red onions are, I guess, better for me when I'm eating it than the other onions. I'm not sure how it is for you.
And I just, really, like broccoli or, what's that long one that grows up
Asparagus.
there?
Yeah. So it depends on, of course, our individual digestion. We can all have um, problems with digestion. So I know for me, for instance, I cannot eat raw garlic. It would burn my stomach for today and tomorrow and next week. But for some individuals, they can eat raw garlic, no problems. So whatever is safe for you, I would say follow that. Everyone is different. But for me, I can eat raw purple or red onions, but not like the raw yellow ones or white ones. However, I would say there's a difference with raw purple and raw white and yellow. Ever heard of quercetin? So quercetin is a very potent phytochemical that actually helps with colds and flus and sinus infections and things like that. Also, it helps with the asthma. And quercetin is found more in the purple onions than it is in the yellow onions, and than it is in the white onions. So you can use quercetin is also an ionophore, meaning it can help ions to get into the cells, like zinc. So if you're sick, for instance, and you're taking zinc, say you have flu or coronavirus, they say take zinc, you have the flu, right? You can actually use onions or quercetin to help to increase the uptake or the availability of the zinc in the body. The highest, the food with the highest content of quercetin is elderberry. Elderberry is also high in zinc. So you can use elderberry when you have colds and flus and all these other things, which we'll talk about later on. Does that make sense? Does that help at all?
So do doctors know why it makes gases? Because I mean, onions supposed to help and be. I mean,
I appreciate your concern. I think it's just, like I said, everyone has different digestion abilities, so to speak. So your gut bacteria helps you to digest your foods, and if you don't have certain gut bacteria, you may be bloated because you're eating onions or broccoli or whatever. So when you have issues like that, you may need to do a detox, but also replenish your good bacteria either through probiotics or prebiotics. Yes.
Which that's similar to what you were saying yesterday with the tomatoes in the nightshade set. Like, I don't have a problem with tomatoes or any.
Exactly.
But there are people that
Who has
are good foods to eat, but because of their makeup, they have problems and they have to go through that. What you were saying, detox, 6 months, come back and add.
Exactly. And it's not really we weren't born that way, but I think a lot of people, even through childhood, we can develop something called leaky gut. And leaky gut can not only affect, like say, celiac disease. Celiac disease is not just relegated to gut. It affects the skin, affects the fatigue, your brain, and other issues, other areas of your body, other organs. But not everyone has leaky gut syndrome or leaky gut issues. And one person can eat something and not have any allergens or allergies to it. while another person may have the same thing and have an allergy to it. So basically, know what is your allergen, know what is your trigger, and avoid it or detox and then try to add it. I know someone, for instance, who couldn't eat avocados. Every time they even saw an avocado, they would vomit. That was my best friend because I got extra avocados. But at the end of the day, she went to another health institute called Meat Ministry, and she had a 10-day cleanse, 10-day detox. She came back, and I was so sad because she was now able to eat avocados. So just doing a detox, I've seen people, can benefit from these things and can enjoy certain foods that they like. But if you know that you can't enjoy it, stop eating it until you can. Yes, you have a question?
Yes, sir. I read about the avocado seed, where you cut the seed up, put it in a bottle, throw some alcohol on it, and leave it there for like 3 days. It's good for pain.
On the outside?
Pardon?
On the outside?
Yes, pain on
Oh,
the
okay.
outside.
I never heard of that, but I wouldn't be surprised.
And the avocado itself, if you have knee problems, you rub your knee, both knees with the avocado. The skin, the whole avocado.
Mm-hmm.
I have knee problems. When I get up from a lower chair, my knee would strain and bother me.
Mm-hmm.
So after I read that, I started rubbing both knees with the avocado every night. I don't have a problem anymore getting up with my knees. I don't have a problem.
Praise the Lord. Yeah, I mean, I've never heard of that, but I mean, there are things that God can use, simple things to do powerful things. Yeah, we'll get to things like that. We'll talk about things like that. But thank you for sharing. What I like for pain, I'll show you how to do a castor oil poultice, and that's something simple you can do at home. Yep. Mm-hmm. So onions, you can also make onion poultice on your chest. Cut up your onions, put it on your chest, and wrap it around your chest with this, or put something over it that can hold it on your chest. And that helps you to breathe when you have a cold, when you have a flu, whatever. It can also help with congestion of the lungs as well. Potatoes. What do you use potatoes for? You can eat potatoes. I love potatoes. You can use poultice. Why do we use a poultice for potatoes?
I remember when I was one of my friends were sick. Her mom wrapped her around some potatoes here. I don't know what that's supposed to do, but it's supposed to help.
Yeah.
But I'm not sure if that's
Exactly. Potato is a drawer, so it can help to draw things out of the body. But it also helps replenish certain minerals, even like iodine and other things in the body. You can put it on your eyes if you have issues with your eyes, and it will draw out if you have a sty, for instance, or any infection of your eye, or if you have like any infection of the eye. You can, if you have open angle glaucoma, for instance, you can use it to help to relieve the fluid as well. So these are things that you can do just to help with potatoes. You have a question?
Your vision, like, as you age?
Oh, that's good. I'm not sure. I haven't used it for that. What's good for that is something called rutin, R-U-T-I-N.
What about macular degeneration?
Rutin, R-U-C-I-N, but also zeaxanthin and lutein and zeaxanthin. And these are things I can write it down for you. But rutin is from herbs like echinacea or other herbs. They extract it from the herbs and they put it in a tablet form. And you can use that for eye issues.
No matter the age?
Yeah, you can use it.
I mean, my dad's name.
I'm not saying that I know it's going to heal his macular degeneration, but you can use it to help him.
When we were younger, green bananas.
Exactly. Same thing with potatoes. If you step on a nail, of course you're in danger of getting tetanus and all these things. You can put something like potatoes on it as well. All right. Other kitchen cabinet remedies: aloe vera, charcoal, garlic, celery, red clover, and hawthorn berry. What can we use aloe vera for? Or aloe? Burns. Was making some, I don't know, meal. And I mean, he smelled like a Chinese restaurant. And he walked in. His hand has second-degree burn. Do I have it with me? Actually, I can probably pass it around. Second-degree burn. And second-degree burn, you have to be taken to a hospital. And he says, I'm not going to a hospital. And I said, okay, let's try something. And we did, all we did was aloe every day. We wrapped with aloe, frankincense and myrrh. Lavender is very good for burns, but also use another one for pain. It'll come to me. No. Oh, you can't use comfrey on the burns. The clove essential oil for pain. Yes, very good for pain. It's the numbing agent. So lavender, essential oil, frankincense and myrrh, essential oils, and also clove in aloe. And initially, we're just taking the gel from the aloe and just putting on the hand. Within 3 weeks, it healed. Within 4 weeks, his skin started growing back, and now you can't tell if he had a burn or not. You had a burn?
Yeah, right here, it was about an inch, and I did it with the iron, it fell on me, and I kind of pushed it up and went more into my skin. You can hardly ever see it now.
Yeah, with his hand, he lives in Bahamas now. You can hardly know that he got burnt. If I can find it, I'll pass it around. But 3 weeks, honestly, it took 3 weeks for him to heal. A second-degree burn. You're supposed to be in the hospital. And aloe is also good internally. So if you have digestive issues, you can also use aloe. 6 ounces before you eat. If you have gastritis or other issues, you can use other abdominal issues, IBS, IBD, Crohn's disease. I had one of my first cases at UT Pines was a 19-year-old who had Crohn's disease, a Crohn's disease flare-up. And his mom says, I went here, I went there, and they were giving him 6-mercaptopurine, which is a debilitating drug. But he's 19 years old, and he's like, I don't want my son to take 6-mercaptopurine. And he is, he's willing to change his diet, he's willing to do all these things. And I said, what can I do otherwise? I said, well, use aloe, and if the aloe doesn't work, use slippery elm. She said she started off with the slippery elm, and she said she switched to the aloe, and the aloe within weeks, no flare-ups. IBS, IBD, ulcerative colitis, Crohn's disease, diarrhea, constipation, aloe is very good for that. So you can use it before your meals. She actually says she reserves the aloe as a backup just in case slippery elm doesn't work, because she knows that it works.
How do you prepare?
Oh, and yes, internally. So you can blend it with water. You can add some lemon water
Just cut the
juice to it.
aloe plant, scrape the
Gel.
gel off.
Yes.
And what, like, how much of this I do each side?
How much of a gel?
It depends. I mean, the leaves are going to be different. In Jamaica, we have broad leaves like these, but I mean, you can have various. You blend the gel in water. You can make up to 8 cups keep it in the refrigerator, make 6 ounces a day. Just drink 6 ounces per meal, I should say. Before you have your meal, 6 ounces. Does that answer your question? All right. I'm trying to pull up trying to find this picture so I can share with you all. But otherwise, what can we use aloe for? So sunburns, also you can use it as a natural suntan. It's sticky, but you can use it to go outside and get a natural suntan as well. For the hair, also helps with hair growth. But I would stay home if you're going to use that. Go outside with that. Anything else? Any thoughts about aloe? Yeah, you can drink it. All right. So everyone, we know these things. Everyone knows these things, but we don't use them. Yeah, some people use it, of course, but these things you can have at home, in your kitchen cabinet or in your refrigerator or in your backyard. And when you need it, especially here in Florida, you can grow aloe in your backyard. Oh, she has some, so go to her house if you want some aloe. And Dr. Robinson, was it? Dr. Robinson? So she mentioned general guidelines. Everything has a point at which you can actually poison yourself. Even aloe, if you take too much especially of the skin, it can cause melanosis coli, which is a blackening of the colon, and that can lead to issues like you can't digest your foods properly, you cannot digest vitamin B12 properly, things like that. So be careful with how you use these herbs. If you don't know the power of these herbs, please consult someone first before you use them. Like I said, turmeric. They say, oh, turmeric is good for inflammation. Use turmeric every day and so forth and so on. But turmeric can actually lower your iron, especially for women. Be careful with using turmeric too much. Or you can use it for a certain time, but stop using it. And if you're using it for a certain time, then use other things like moringa. Moringa is very high in iron, or stinging nettle is very high in iron. Dandelion roots are very high in iron. If you have to use that for a long time, then use something that is going to replenish your iron or other electrolytes. Even calcium. Turmeric can also pull out calcium from the body. Not as much as iron, but it can also affect calcium levels. Once you affect one mineral, you can affect all the minerals, but it's not as much as the iron and the calcium. So understanding correct dosages, when to use it, when not to use it, possible effects and side effects. Also in pregnancy, certain things you don't want to use when you're in pregnancy or children under certain ages. You don't want to use powerful herbs like golden seal in children, at least a long period of time. And how to make teas, how to make herbal teas. You can take a picture of this if you want. And we have this general guideline. For powders, for 1 cup of water, you use 1 teaspoon. And for steep for 15 minutes. For leaves and blossoms, in 1 cup of water, 1 teaspoon, steep for 30 minutes. For barks and roots and seeds, including Podiarco, for every 1 cup of warm water, 1 teaspoon of the bark and the seeds and the roots. And boil gently for 10 minutes and steep for 20 minutes. What you can also do with this is, instead of adding 1 teaspoon per cup, add 2 teaspoons per cup. Say, for instance, you're not getting a benefit from your hawthorn berry. Hawthorn berry comes in little seeds. So what would I do with hawthorn berry in making a tea? High blood pressure and also heart. Yeah. Heart health. Yeah, so you boil the seeds gently for 10 minutes and let it steep for 20 minutes. And if, say, 1 teaspoon is not working, Then you add another teaspoon to that other cup, and you can go up to three teaspoons. If you go up to 3 teaspoons, it's still not working, and add another herb to it. So these are ways to use these herbs safely. You don't want to overdo the treatment or overuse the use of the herbs, but also you want to, technically you can, but I would say if it gets to 3 teaspoons and you're not finding any benefit, add another herb to the mix. Like motherwort. Motherwort also impacts the heart. It actually works well with hawthorn berry. And motherwort is also very good for anxiety and depression and all these things as well. So you can get a benefit from that. But if I have, say, moringa comes in leaves and also it comes in powder. So, but if I have moringa leaves, what would I do with moringa? How do I make a tea? Yeah, steep it for 30 minutes. And that's simply what you can do to make it more effective. No, you boil it, put the keep it on the stove and just cover the pot. Yeah. Yeah, you can. So that way you use it as a powder. Yeah. Does everyone have that? Yeah.
How do you use neem?
Neem.
Powder.
You can drink neem powder. It's very good for like parasites and things like that. Yeah, you can. But neem can be poisonous if it's taken too much. So be careful with that. And we talked about elderberry. You can use elderberries. Elderberries come in berries. So 1 teaspoon. Ginger root. You can get ginger. You can boil it, yeah. Ginger roots, remember the roots? What we did for, what do we do for roots? Boil them for 10 minutes gently and let them steep for 20 minutes. Echinacea root, same thing. And you can mix certain herbs to make a tea, for instance, the feel better tea. And the echinacea root and the ginger root, you boil them. And the berries, you boil it as well for 10 minutes. But say I have echinacea or a root powder. What would I do with this? I will boil the elderberries, I will boil the ginger root together. And then after it's finished boiling, I would add that echinacea root powder to it and let it steep for 15 to 20 minutes. Yeah, so you can add different types of herbs or substances of herbs that way. So elderberries also sometimes comes in powder as well. So you can follow these instructions. Boil 3 cups of water, add the echinacea and the golden root, let boil for 10 minutes, then turn the heat off, let steep for 5 minutes, then add the elderberry, steep for 15 minutes, then you can drink that. Yeah. And you can make big batches. For instance, we'll tell people if they have cancer, make big batches, put it in your refrigerator, and heat it up if you want to, or drink it throughout the day. Some herbs you don't want to leave outside because they can start to mold, and you don't want to be drinking mold. But also after 3 days, it loses its potency. So you make a batch for 3 days and that's it. You make another batch for another 3 days. And technically you don't want to mix more than 4 to 5 herbs at a time because they can counteract each other. So you don't want to mix a lot of herbs. And you can drink 2 to 3 cups daily. Drink more than that. Like peppermint, I love peppermint tea. I try to drink it more than 2 to 3 times sometimes. Does that make sense? And that's it. We're going to show you how to make poultices, but also how to make a nature's flu shot. Is that okay? You get to taste it as well. All right. Hopefully we get to do it in 30 minutes. Yes. Question? Yeah, you can bathe. You can bathe in them. You can add it to your bath water. There's something called limonene in the orange leaves. All the citrus fruits have limonene. It's good for many things, colds, flus, high doses. It could be good for cancers, these things. So, yeah. I was trying to find the picture, if I can't. You all learning anything today? Anything new that you learned?
Sir. Baking soda.
Baking soda? Baking soda. What in what sense? I use baking soda, for instance, for like. No, not internal. I found it. All right. So I'm just going to share this. By the way, I remember one time at UT Pines, we had a guy, he was diabetic, and of course, diabetics, they're more prone to infections when they have cuts. And this guy, he was going through treatments, and one person didn't adhere to the heat requirements for hot foot baths, and he had blisters, and those blisters turned to cuts. And for a diabetic, this would not heal as fast as as a normal person. So I said, you know what? Let's put some comfrey on it, and we can pass this around. And then I showed the last picture. This is a stage of page 3. Oh yeah, I have the So basically, we started to use comfrey on it, and comfrey powder. That is comfrey powder with castor oil, and I think that was it. That's all we used. And the person, for some reason, a day later, he had a seizure, and he had a stroke. Actually, he had to go to the hospital. And I remember I was at the hospital with him, and I said, "Man, what are you gonna think about this bush on his foot?" I was like hesitant to think about, I was thinking I should take this off before he goes into the hospital, but I didn't want him to see me take this thing off, and this bush drops off. And I was like, man, they're gonna look at me as a quack, and all these things going through my head, and this bush is gonna make me look like No, it was comfrey.
Oh, comfrey.
So I went back the next day. So this was the Friday. We put the bush on. The Saturday, he went to the hospital. The Sunday, I went back, and his cuts were all healed.
What? Within 3 days?
Within 3 days, his cuts were all healed. And I said at that point, I would never question God. Never. I know that these things can work.
So he kept the bush on in the hospital?
No, the bush came off.
Oh.
The bush came off on the Sunday, basically, but it was healed afterwards.
But did you find out why he had a stroke?
Yeah, we did. He had sleep apnea and other things. So the bushes do work.
Comfrey, excuse, comfrey, when you put it on you, comfrey, yes, something use it fast because it comes in a cast. It comes like, you know, like if it, when you, like if you put it on your shoulder,
Yes.
you mix it, apply it, it's hardened, so you have to use it.
You can make it more watery though, and I like to use it with castor oil for that reason because it keeps it moist. Yeah, it makes it with castor oil, exactly. Even the leaves, you can crush the leaves, wash the leaves first, crush the leaves, and mix it with castor oil, and just put it on the area. Yeah. So comfrey is called neck bone. Even the healing of bones is off again. Is it? Everyone see it? Okay. Let me show you the healing. Yes. So this is 3 weeks after the aloe. So cough syrup is coming, but also we're gonna make some poultices. And what I like to make poultices out of is with using Chuck's pads or absorbent pads. And this is one of the best ways that I've found to use absorbent pads to make poultices. We're gonna use that today. These you can get at Walmart or Walgreens or CVS. And the reason why I like these is that you can, well, I show you. You can cut it to size. Oh, by the way,
Let me see.
yes. By the way, this is a blue syrup. Contains echinacea, elderberry, ginger, peppermint, garlic, cayenne, water, glycerin, and essential oils. You can wrap this one on. These are from a herb shop from Beachy Pines. This is like $15, but that's something that if you win the raffle, you can get. Yeah, raffle this one up. It's also something for anti-parasitics. And anti-parasitics you can use things like olive leaf, black walnut, artemisia, or it's called a wormwood, cardiarco, cat's claw, and glycerin. That's basically yes, parasites. What I can do is cut this size. Go on my neck. If I want to use this my neck, I can cut it to size. And what I like about this is that you can have a layer where you can lay your poultice and then cover this. And take this take the sides and add it to the area. So, who knows how to make a charcoal poultice? Yeah, water.
And flaxseed.
Water and flaxseed, but you can just use a. You have some water, please. Water. Water. No, it's okay to use it I mean, I wouldn't. Castor oil? No, there's no problem with having that. No. No. Yeah, now if you're using essential oils with the castor oil, that's gonna be a problem. Like, say clove oil. I remember putting clove oil in plastic and it burnt through the plastic. So it's very powerful. Like, oregano oil does the same thing. Other herbs will do the same thing. So if you have it, the castor oil with clove oil or with oregano oil, it can do the same thing. It basically rolled the plastic container. Oh, thanks. Thank you. All right. So technically, you want to use like a tablespoon, but I just use for demonstration's sake. Two teaspoons for demonstration's sake. And this is the easy, clean way to mix your charcoal poultice.
What is this called? What is
But I'll explain. We know for cholesterol, for detox. What else? Insect bites, yeah. Burns? No. What would we use for burns? Aloe. Yeah. You can also use potatoes as well for burns. But if you may more likely have the potatoes at home than the aloe, so you can use the potatoes as well. But like I said, she has aloes at her house, so if you want to go raid her house. What's your name again? Where do you live? And a good thing about this is you can make it in a bigger bag. You can use this and put it in the freezer until you're ready for it. I worked at a place called, also worked with a place called Living Springs. It's another lifestyle center. And this is where I learned to do this. There's a lady called, her name is, I forget her name. Barbara O'Neill tends to go there. And when she goes there, it's packed. It's a very good place. It's not as equipped as UT Pines, but they get the same results. So right now, this is too watery. You want it like a thick paste. So I guess I am going to use that extra teaspoon.
Did you do flaxseed to thicken it?
Yes, you can. So you want to do a 1-to-1 ratio of flax and activated charcoal. So if you use 2 teaspoons of the charcoal, you use 2 teaspoons of the flax.
I've used oatmeal too.
Oatmeal, yeah. Oatmeal is good as well. But flax is also helps to draw certain things as well.
You're making that.
No, on the outside. Now, flax or oatmeal. Oatmeal, you know what oatmeal is good for on the skin? Itching or, yeah, so you have psoriasis and dry skin and all these things you use. Yeah, colitis.
No, I said it's a colloidal.
Oh, okay, yes. You can use it for, say, for instance, you want to make a charcoal poultice with the oatmeal if you have issues with your skin like itching or burning or chicken pox, these things. Yeah. So this is feeling good. So you want to mix it out so it's a very like clay-like consistency. We'll let you feel it before. Do you approve? Yeah, putty. Yeah, it's like similar to putty. Uh-huh. Like I said, you can put this in the refrigerator, or the freezer, I should say, and store it for a later time, for a time of trouble. All right, I think this should be good. So you can pass it around and feel it. And once I'm doing that, once you're doing that, I'll make a castor oil poultice. Castor oil is one of my favorite oils because I had a personal experience with it. I had tinea versicolor growing on my skin. It was uncontrollable. It was going in even into my ear, from my chest to my ear. It's a fungus that grows on your skin fungus basically. And I use charcoal. Not even charcoal. I use oatmeal soaps, everything, and it would not go away. And I was frustrated. And someone said, "Oh," and this was when I was in my last year of medical school. Someone says, "Oh, just use castor oil." And I said, "Castor oil? What is that going to do to my skin? I'm not going to use castor oil." But at night, I would get up and it was itchy. I said, "You know what? I'm going to try this castor oil." I tried the castor oil. Within 1 week, it was gone. I had it for 2 years. Yeah, rash of my chest, in my ear. I actually use these. Man, my brain is not working right today. The Q-tips with castor oil in my ear, and it worked. So
You just rubbed it in?
yeah, it's rubbed in. Yeah. So what you can do, castor oil is a very good penetrating oil, and other good penetrating oils are black seed oil. Now, the castor oil, I usually like to use 2 ounces. So something like, 1 second. About 2 ounces, right? Yeah. And this you can store. Someone can take this home today if you want.
Yeah.
What I like to add to it are things like if you have pain, if you have like arthritis pain or things or joint aches and pains, you can use cayenne pepper in it. You can use yes, and also ginger is known to work better than ibuprofen and things like aspirin and these things. Sorry? Yeah, blend the ginger or use ginger powder.
Where the pain is?
Exactly. Yes. So I'll show you how to make the poultice. So this is about a little bit more than half a teaspoon. Thank you. And obviously you can add essential oils to it as well. Lavender to make it smell good, but it's also good for skin. You can also add frankincense and myrrh. Frankincense is very expensive. You can add peppermint to it if you have neuropathy. You can add peppermint to it. If you have if you have neuropathy, you can use wintergreen. There's a lot of studies that show wintergreen is very good for neuropathy.
Just castor oil by itself?
Just castor oil. Yeah. You can also add other things to it that like essential oils, like lavender, a calming, soothing herb, or
How many drops?
3 to 5 drops. So this is our castor oil cayenne mixture. You can also add turmeric to it, but many people, they'll turn into a Oompa Loompa. Yeah, I'm dating myself, I think. Basically, you'll turn yellow if you use, but turmeric is very good for psoriasis and inflammation, all these things with the skin issues. Actually helps to regrow tissues as well. So you can use castor oil to help to regrow, dead skin and alopecia and all these things by using it with castor oil. Yeah. Cayenne pepper will burn, but it won't burn the skin. It's a warming sensation on the skin. It's not a burn. Now, if you put it in your mouth, it's going to burn. Put it in your eyes, it's going to burn. So what I would do is just lay it on this portion. So the way, like I said, the reason why I use this is because I can take this layer off and use this as my base. So whoever suffers from neuropathy, like I said, you can add things like wintergreen, camphor, or peppermint essential oil, 3 to 5 drops each to the mixture. Mix it up. This you can store for later, for another time. You can actually reuse this, but I'll talk about it when we come to making the poultice or the charcoal poultice. Do not reuse the charcoal poultice. You know why? It draws. And once it draws everything for 8 hours, after 8 hours, the things that it draws out of the body can actually go back into the body. Potatoes as well. You don't want to continue to use the potatoes. Sorry.
What was the charcoal for? To take it out of there and put on the skin?
Yeah, you can. I'll show you, basically. But charcoal, you can also drink it a tablespoon per cup or per every 2 cups. You can also drink it. Yeah. So what you can do is, at this point, take the edges. Thank you. You tape it so that you can fold it over. Just to make it edges. Now you want to clean the surface because this is going to go on your skin. So you don't want to dirty the surface. So take all the edges that are open, essentially. Exactly. And castor oil is very stained. So if you like your sheets, aim not to have castor oil staining your sheets. If you don't care, you can have dark sheets or sheets that you don't mind getting dirty. Are you able to see this? It's basically, I'm just taping around. There's no science to this. Just cut and taping. just remember to have a clean surface, so you're not adding things to your skin. So this is the poultice you can add to your knee, to your ankle, to your neck. Someone with hypothyroidism, for instance, can use this because it helps stimulate the cells to make thyroid hormones as well. The thyroid? Yeah, put it right there. Yeah. So cut it to size, put it on your neck. If you have a sprained ankle, cut it to size, put it on your feet.
And you keep it on for 8 hours?
Yeah, we keep it on. This you don't have to worry because it doesn't go off. It actually goes, like I said, it's a very penetrating oil, so it penetrates the skin and nourishes the skin, but also the organs as well. Okay. So it can bring a lot of phytochemicals into the skin.
Okay.
You can add ginger to it, essential oils to them. Whatever you add to it, basically the castor oil helps to bring in inside of it. Any thoughts or questions? Yeah, you can wash it off as well. You can also just use castor oil just like this to make a castor oil pack. Like say, for instance, you have fibroids or other issues, you can actually lay the castor oil pack here. And then you use, what I like about this is also, you can also use a heating pad on this side to help stimulate the oils to penetrate more. So I've seen people with large fibroids within weeks, just using the castor oil pack, they start to shrink and shrink and shrink until there's no, shrink like a raisin basically. Yeah, I'm not kidding you. Oh, I'm not kidding you. I wouldn't do that. Sorry? You can. You can do it on an open wound. And like I said, you can even add comfrey to it. Comfrey and turmeric to it because they heal the cells. Turmeric is all known as a cell proliferator. So it can help to grow certain cells. But like I said, you may look like someone yellow for some time. Now, you don't want to use certain things like charcoal in an open wound because it can tattoo your skin. Some people say that it doesn't, but in most cases, when your cells are growing, it's actually taking in those charcoal molecules, and it's a permanent tattoo. Yeah, you don't want, if you don't like, I mean, if you have it on your back, you don't care, that's fine, but you don't want to have it anywhere else. So that's it. This is how you can store this in the refrigerator if you want. You can fold it over and store it till later. You can heat it up. And you can make multiple ones for someone that you can help for yourself, and then use it when you're ready. Yeah, because, and be careful with this.
How often can you use,
Is it one
can you reuse the castor oil pack?
You can. I would say 2 or 3 days max.
The same one?
You can use you can use that. But obviously, if it's the oil, you see how it's oily. Obviously, if it doesn't look like that, then you may want to do another one. Yes, you can put castor oil on your skin like that. You don't necessarily have to use it. It's actually soothing as well. So if you have a constant itch, you can just keep a poultice on, like at work or wherever. It depends on. Yeah, if you do, honestly, then find another source because it depends on the source as well. You can use black seed oil. You can use even coconut oil as well. So I make small little. This is it for maybe the nature's process. Nature's sushi shop.
So that you know, this presentation is going live on our YouTube channel. If you wanted to text people, she's going live and it's going to be available for you if you wanted to watch that later on, so that you just know. Okay.
This is it. This is your charcoal focuses. You can also use things like this for brushing your teeth and different things. You can add like peppermint to it to make it. Charcoal is a drawing, so it could be like a whitening agent. Well, yeah, exactly. This is a little too thick, but we'll just go with it anyway.
Since you were talking about heat, what is there a good, is there a natural chloride instead of using, you know, something that's naturally doing the same thing? What it does?
Yeah, things like oil pulls, for instance. Oil pulls, like coconut oil or even castor oil. You can use castor oil as a pull as well. Just put it in your mouth for about 20 minutes, or 10 minutes or so, 5 to 10 minutes. Swish. Yeah, strengthens the teeth as well. These natural whiteners and things like that, they weaken your teeth, but things like coconut oil and all these other, even olive oil, you can use those things to strengthen your teeth while you're cleansing your teeth. Yeah, exactly. And then, but you can also use things like charcoal and.
What about cloves?
I wouldn't use cloves on a daily basis. I would use it. I would know. I would use it just for you know, when you have a toothache or tooth abscess or whatever, and you have issues there. It's very thick, so.
But the castor oil you would be able to use every day, you saying?
You can, yes. The castor oil. You mean for
switching?
Yeah.
Instead of fluoride.
I would do it every. I mean, you can't use it every day, but I mean, it's going to be. It takes like 5 to 10 minutes to do that. So if you want to do that, you can. I tend to use like once or twice a week. That works.
And so you just use a little bit of water with it, or how?
No, just put like say teaspoon or 2 in your mouth.
For 5 minutes, swish it.
5 to 10 minutes.
Okay.
5, 10, why not the 20 minutes?
You can do it if you want. If you have 10 minutes, you can do 20 minutes if you want. But I choose. I get the benefit.
Castor oil and coconut oil.
Castor oil, coconut oil, all the oils. Yeah, all the oils basically do that. Fools, also strengthens at the same time. How long do you do it? How long do you go Question.
What is wrong with chewing cloves?
What is wrong?
Chewing, I read in a book where you can chew 3 cloves with your head every day.
Okay.
What's wrong with that?
Why do you think there's anything wrong with it?
I don't know, I heard you say something that
You wouldn't clove every day.
The clove can be caustic to the stomach. If it can cut through, if it's very potent, it can cut through, or concentrated, it can cut through plastic. Imagine what it does to your stomach. So yeah, you want to be careful with that. Not saying you can't ingest clove, but I would try not to do it on a daily basis. And like I said, our skin, our GI tract are very sensitive, so you don't want to use a lot of things like that. could disrupt the function. Does that make sense?
Yeah.
Okay. All right, I agree with you too. All right, so this is the last poultice. Basically, it's the Celtus. It will be. Yep, exactly. You can drop water on it, or you can drop, like, say, some castor oil on it to make it better. Because it's actually turning into like clay right now. You're softening up from adding these things on it. All right, so that's basically and this is messy if you don't mind. And charcoal also stains, so be careful as well. So I'll pass this around. Be careful. You know what? Let me put it in a. You can take it out at your own risk. That's it. How to make charcoal poultice.
Can you repeat again what each one does?
Oh, say okay. So the charcoal poultice is good for drawing. It's also good for like it's good for things like I use it for hyperthyroidism. Also, it's good for cleansing certain areas like the thyroid or the liver, or even on your feet bottoms, the bottoms of your feet. You can put it on areas where there's pain as well. But the castor oil with the cayenne, I would mostly use that in the charcoal. And the charcoal you can take internally. Otherwise, you can detox the body. You can lower your cholesterol. The castor oil is very nourishing oil, but it also helps to heal as well at the same time. And it can also help to bring in certain good phytochemicals into the body, like phytochemicals from the turmeric or the cayenne or the essential oils that you will use. It's a very good carrier oil as well. So for instance, if you have neuropathy, you can use a castor oil with the ginger and the cayenne, but also add things like peppermint oil, essential oil, wintergreen essential oil, camphor essential oil, or you can even also use comfrey as well, comfrey essential oil. Any other questions?
Can you use one after the other one?
You can use one after the other one. All right. So do we know are we comfortable in making? Are you comfortable in making poultices?
Yeah.
Great. Anyone not comfortable? With what? Herb poultices? Yeah, you can. I don't have. You can make one with the onions. You can put it under the bottoms of your feet. You can make one with, sage. Sage is also good for healing the skin as well. So you can make one with herbs. Live herbs. Yes. This is This is the pain salve, by the way, and the pain salve contains olive oil, castor oil, beeswax, white willow bark, garnet pepper, comfrey, devil's claw, turmeric, St. John's wort, peppermint, ginger, cayenne pepper, vitamin E, and essential oils. So this is something that you can use pain. If you can buy this, or you can make it with the castor oil and the cayenne pepper and ginger. This is my friend right there. Yes. That is something, it's a pain salve mixture. Now, you can make this, for instance, into a salve by adding beeswax to it.
Okay.
So beeswax, it's like a thicker lotion type of mixture.
Okay, so while we transitioning, we got 3 more items to give out. So if you pull out your tickets, we're gonna draw a little bit.
Yeah. 345,097.
9-7.
Okay.
345,076.
7-6. Turn it around and say 6-7.
Go with that, okay.
345,069.
6-9. It's 9 over here.
Where?
6-9.
Oh, okay, got it.
There you go.
Yeah.
Four, 5, 107.
107. Yay! What you got, brother? Key. What you got? Good job. Yeah.
Garlic,
345,072.
That's the first several. You either drink or you're on.
345,090. 345,061. 345,101.
Oh, he already, it was his? 061? 061?
34110.
Stir them up, stir them up. Stir them up, stir them up.
345,111. 345,082.
082?
Is that it?
Yeah. Well, who else knows anything here today? Look at him over there.
We got lotion.
You have it in good, right? Do you have it? You don't know? Okay, if you've not received anything at all. I'm not talking about the Vaseline, the lotion. Okay. All right, I'm going to give you one. One of this. Who else? Give you one of this. Who else? You know, you have this. This is U-turn, understanding, preventing, and reverting lifestyle bad death hands. Dr. Hans, he's the one who made a CHIP program, and he died last year. So, Dale Hans, he's the inventor of the CHIP program we've been doing. The CHIP program, the guy who wrote that, do that. Give you one. Give you one, brother. You should have that. Give you one, brother. We ordered this from the ABC store. Yeah. Tell you one what comes. I want to make sure everybody who comes gets something. Right. Anyone else need something? There you go. Anyone else? Anyone else? We're good. Which color do you want? Yeah? What one? All right, who else? All right, this is our young man here. Which one? I'm going to give you green. So this is our bond. Do you want here? White or green? Which one? Which color? White. You can put some pass. Young man, you want some pass? Let me go to ladies. The man has been trying to get everything here. Ladies, who wants some pass? There you go. All right, she wants one right here. Which color? You want white? Yeah. Good.
Give me one.
All right, I'll come. You want one too? One to go. All right. All right. Veterano, you ready?
Yes.
Okay.
So we're going to make something called Nature's Flu Shot. And this is good for colds, flus, any congestion, both preventative and also curative. What you want is at least a medium-sized pineapple. We have this already cut. You want 2 onions. Onions itself, or the lemons themselves, but to get the yellow parts off, most of the yellow rinds off of it. You want garlic, 1 clove of garlic, one bulb of garlic. And maybe, I love ginger, so you can use as much ginger as you want. But at least, like your pinky size worth of ginger root. You can also use things like turmeric. Turmeric goes well with the pineapple. Pineapple, especially the hearts, have something in it called bromelain. And bromelain actually helps to extract curcumin from the turmeric. And curcumin is what helps with pain and inflammation and other things. I like to add horseradish as well. Horseradish, especially if you have sinus problems or if you have nasal congestion, especially with COVID, you notice that you have a lot of sinus issues. So you can use that horseradish to your benefit. And that either you get the root itself, the horseradish root, or you can get the horseradish in like a jar or whatever. It's very inexpensive as well. And you also need peppermint. This after you mix the mixture, you can add a few drops, like 10 to 15 drops of peppermint in it. You could also add oregano oil if you want. Like I said, I used to use peppermint oil, but you can use oregano oil, among other oils. Like it's eucalyptus oil, you can use that as well. You can use honey if you like. I tend to not use honey because it's sweet enough with the pineapple. But you can use that. You can use tablespoon or two of the honey inside this mixture as well. So I'm gonna retrack what the items are. Basically, 2 onions, medium-sized pineapple. This is a large-sized pineapple. 6 lemons, and cut them down to the white portion of the lemons. You may have to make this in 2 batches, by the way, depending on the blender you have. I like the Vitamix, and some of them have wider canisters. You can also use Blendtec. I like it because it makes it more smooth, a smoother consistency. If you're going to use a regular blender, just know that you're going to be having more fibrous taste to the mixture. And then we have 1 bulb, the entire bulb of garlic. We have ginger to your taste, or half a pinky finger or so. And then you have peppermint essential oil, 10 to 15 drops after you mix this mixture. And a teaspoon, quarter to a half a teaspoon of cayenne pepper. Now imagine cayenne pepper with the horseradish. It will make it more, more hot.
Do you have to have a certain heat unit for the cayenne pepper, or just any?
You know, honestly, just any. I had a friend who had a heart attack, and he was at Walmart in the parking lot. He called me and said, "My chest is burning, my chest is aching, and I have the pain radiating down my left arm and my jaw." And I said, "Yes, it's a heart attack." I didn't tell him that. I said, "Run into the Walmart, get some cayenne. He got some cheap cayenne." And I said, "Take a teaspoon and swallow it." And I said, "Call the ambulance." He called the ambulance, and they came to him and says, "Oh," he had no pain at this time. And he said, "Oh, they did EKG and everything. Nothing on the EKG. Didn't show a heart attack. Didn't show anything." So they left him there, and I said, "No, go to the hospital." He drove himself to the hospital, and they did blood work, and they found that he did have a heart attack. His troponins were high, and they sent him to another facility to get treatment. So basically what I'm saying, any kind will work. I don't think, well, of course, 90,000 HTUs is better, but it can work, but any cayenne can work. Does that make sense? So you can also use honey, like I said, 1 or 2 tablespoons of the honey as well.
Peel off the lemon?
Yes, peel the lemons to the white portion of the lemon. Question in the back.
So you recommend taking cayenne pepper at that point in time over aspirin?
Oh, for sure. Cayenne acts like, I'm guessing you're asking about like heart issues.
Right.
Cayenne acts like nitroglycerin. You can put it under your tongue, and it goes straight to your heart, so to help the system, just like nitroglycerin to help the heart with heart pain, or even the erratic behavior of the heart, like atrial fibrillation, when the heart is not beating correctly. You can use it to help. You can also use it. Well, I like to use it in like warm water. Let's say, for instance, for strokes as well. If you have strokes, you can use cayenne in some warm water, 4 ounces of warm water, just drink it, and obviously call the hospital as well. But you can use that to help and to limit the signs and symptoms of the stroke and the heart attack. Yeah. Like I said, I've seen it. It's not something that I'm just saying. I see it.
So no, you told him to go to the hospital and it helped, but instead of doing medication, is that something he could have used his cayenne pepper on his food and stuff to help with the problem until it kind of leveled out, or?
So, in many cases, people will have warning signs periodically. So I think there are some ignored warning signs there. But when it gets to the point where you can't ignore it anymore, I think it's best to be in the hospital to get further treatment. But you can use it as a preventative means, even for things like we treated aortic valve stenosis and the issues with it with cayenne pepper. One more question. Yes.
Oh, yes. Someone told me that aspirin, the 81 something.
81 milligrams, baby aspirin.
Yeah. Take one aspirin every day.
Okay.
One aspirin every day. Well, if you're having a heart attack, say you're having a heart attack, you take hot sauce.
Hot sauce.
Hot sauce. You take like 2 spoonfuls of hot sauce, and that's gonna get the heart pumping as it should again.
Well, that's what I'm saying. Cayenne can help with the heart, and what I said, it's you can put it under your tongue, and it goes directly into the system, just like works like nitroglycerin, to stop the chest pain and the heartache, basically. But you can also use it in warm water. So 4 ounces of warm water, drink that with drink about a quarter teaspoon to a half a teaspoon. Drink that, and that helps as well.
So what about the 181 something mg aspirin every day?
Are you asking me if I recommend aspirin?
I do that. I take one every day because that's what my doctor.
There's a lot of studies that show that aspirin does not help as much as we think it should. A lot of cardiologists are now moving away from aspirin. So I'm not telling you not to take your aspirin, but I'm telling you that you don't need it. Yeah. Yeah, I'm not saying you not to take it, but I'm saying you that you didn't need it.
I do several checks. I have my heart checked several times. And thank God it's functioning perfect.
Yeah. Well, I would say that Dr. Thompson? Yeah. Dr. Thompson Robinson was saying that salicylic acid that makes aspirin, you get it from white willow bark, and you get it from meadowsweet. So in essence, you can get your aspirin from those herbs. So you don't necessarily have to use aspirin. You can use other things. The issue what I have with aspirin and all these things, it can cause ulcers. There's a lot of people who are more sensitive than others to ulcers, but the stomach ulcers and destroying the stomach lining, for instance, and it can lead to acid reflux, among other things. So you want to be careful with that. And actually, using a lot of aspirin can actually damage the heart long term as well. Yeah. So there's a lot of research that shows this as well. It's not something. But again, I'm not here to say you should come off your medication, but you don't need it. Yeah.
Yes. What about cayenne? Can it cool down as well?
No, cayenne actually is it's a prebiotic, so it promotes good bacteria, and the good bacteria can actually help to protect the coating of the stomach lining. But obviously, I've experimented with cayenne. If you use too much, it can cause racing of the heart. I mean, to the point where you're anxious, as if you're in an earthquake or something like that. So be careful with the amount that you're using. Start off with a quarter teaspoon, or even an eighth of a teaspoon, and move up. But if, say, for instance, if you're having a heart attack, a quarter teaspoon to a half a teaspoon would be helpful. All right, so I'm going to mix this, and then we can have a taste trial.
Yes.
The video support is all right. Yes. Okay, sure.
I didn't bring the plunger.
Oh, you didn't? Young man here. Young man, but yes.
Who wants to test? Want to line up? Stand the line. Stand the line if you want to test.
She coming again, sorry about that.
She dropped me off.
So what is it?
But I have a high right. Let me see.
Yeah, I heard that they said.
We did that.
Oh, yeah, and then they don't. How much are you supposed to take this every day?
Instead of using peppermint, if you don't like peppermint, you can use eucalyptus essential oil. You can also use, another thing you can use is pine needle essential oil. Pine needle essential oil is very high in vitamin C. There's other things that you can use. You don't necessarily have to use peppermint. You don't have to use the cayenne. You use other things like horseradish only. You can substitute other things, basically. You can add water to it. You can use less of the recommended dose if it's too harsh. You can do that as well, especially for children. You don't want to use. The children love it because of the pineapple taste, but you can lessen the amount of cayenne or lessen the amount of other things that you're using. So how was it? Perfect? Yeah. You can use it as prevention. You can use it as, say you take like a tablespoon a day or something like that as prevention. A tablespoon every so often. Yeah, so I try to use it within the week because the herbs will go bad, or you lose its potency. Just like the teas, you lose its potency. So try to use it within the week. Make another batch as well. You can also freeze it. You can freeze it. If you make a big batch, freeze some, and then you thaw it out and use it when people are sick. So you can make it before, say, flu season. Put it in the freezer, take it out, thaw it out, and use it when you need it.
Now, how long will it last?
Oh, for months, 3 to 6 months, maybe. But children love it because of the pineapple. But use less pepper, use less of the horseradish and these things that are very harsh. No, there's no horseradish. If you had horseradish, you would know. You do? Well, I hope that you had a learning experience. I hope that this was a good experience overall. I just want to say, I didn't really, we didn't really pray before these things, but when doing these things, always pray. Even making your poultice, you pray and ask God for healing. Even doing your mixtures, don't just make your mixture, you pray when you're making your natural remedies. Like I said, God is the one that's using this to heal you. It's not the pineapple, it's not the bromelain. We can know all these things about all this, all the benefits of the foods, the limonene and the quercetin and all these things. We can know all these benefits, but if we don't know the one who heals us, we will never be healed. That being said, I appreciate being here. Thank you for having me here. I hope that you learned a lot. I was blessed as much as you think you were blessed by me. So I really appreciate, and hopefully we'll see you soon.
Well, we want to thank Dr. Randall for the wonderful presentation. He's been here through weekend. We want to, God to be able to help you in your ministry and be with you all the time, so to sustain you. We want to thank everybody who were able to come this afternoon, and those who have been here, have been attending this since Friday. So I don't think anyone else has any further questions. So we're gonna close right now. If you have any question, for those of you who did not get the opportunity to see Dr. Randall, who had their name, I think we saw everybody. We still have one more person, okay. But I don't think that's gonna be this evening. I don't think, probably we'll give you a phone call. We had one or two that didn't get seen. Give them a call. Yeah. Give them a phone call. Huh? Okay, so maybe two, if you could stay behind and be able to see him very brief, 10 minutes only. And other than that, so we thank everybody. So we're gonna close our eyes for a short prayer, if that's okay. Let me give Brother Cousin to lead us in a little short prayer. Richard.
Let us bow our heads. And dear Father, we just want to thank you again for the opportunity to be here and to learn this new and more insight on our health. And Father, we ask that we will pursue these things and live these things in our lives. And we ask, Father, that you would give us more insight and more wisdom in how we live and what we eat and our whole, and to follow your 8 laws of health. We thank you for Dr. Randolph, that he was able to share all this information with us and give us more insight. And we ask that we will implement these things in our lives. Continue to bless us and be with Dr. Randall as he travels back. Give him safe travel on the plane and help him to get there safely, and also continue to be with his ministry. In the precious name of Jesus, I pray. Amen.